I think it's interesting that this may solve some of the issues we have about having to substitute a bottle. I mean, when a mother goes back to work, you've got to feed out of something. And we have a great argument with in the breastfeeding community. Some people are just absolutely adamant about no bottle. And yet they recognize that mothers go back to work, somebody else feeds the baby. Now, what are you going to use? An old shoe? I hope you're going to use as physiologic a bottle as possible.
That's what we need to. That's what we need to keep
and bottle
working
is
on.
not a dirty word.
Okay, thank you.
And that's, I fight this battle every day.
I've started looking into preemies and their issues, and I know now that they have to be 35 weeks gestational before their suck is neurologically ready.
Who said that?
Oh, I went through training. It's called Neonatal Oral Motor Assessment, NOMAS, and they were saying, usually by the time, they're gestationally 35, the NICU will start expecting. What's your experience?
We feed them sooner than that.
Okay.
And you can put a baby to the breast at 28 weeks.
Oh, this is the reason why we're videotaping. But I need
you look surprised?
Yes.
Not every baby. Baby's different.
Right.
But I've pictured of 28 weekers who weigh barely 1,000 grams doing very well at the breast.
Good.
And learning. I mean, they obviously don't have all the strength nor the reflexes or anything like that. But we should introduce the breast is way sooner than 35 weeks.
Okay, I'll have to check mine.
Usually I don't use personal stories, but my daughter had 34-week twins delivered by emergency C-section because they were discordant. One of the babies weighed 2,500 grams, and the other weighed 1,000 grams. Those babies never had anything but the breast in their entire lives.
Wow.
And they were mathematically and diagnostically 34 weeks. And the little 1,000-grammer, well, he's 12 years old now. What a tiger.
Thank you so much.
You obviously have to work with a preemie a little bit more. And, a mother with a very big breast is going to have to manage her breast very carefully for a small preemie. But babies under 35 weeks is late. So there may be some scientific reason for that. From a practical standpoint, when you're interested in getting calories into a baby safely and establishing breastfeeding, way younger than that. So there may be a suggestion that we think is very foreign to us, but you always have to listen.
That's our mantra on our website. Listen, listen, listen.
Yeah.
Thank you so much.
Well, you're welcome.